Welcome to this week's edition of NHIS in a Week. In the headlines, Dr. Bawumia launches new My NHIS app to improve access to healthcare. NHIS CEO touts NHIS app. Kumbungu gets new NHIS district office complex. And the NHIS chief executive visits Savannah region. Now to the details. A new comprehensive online self-enrollment portal designed to make registration onto the scheme and renewal of existing membership possible has been launched by the Vice President, Dr. Muhammadu Bawumia. Known as My NHIS app, the new application includes a number of user-friendly features, such as enabling persons desirous of enrolling with the NHIS or renewing membership for themselves and others to do so in the comfort of their homes using their mobile phones, instead of having to do so at the NHIS district office.
And this is why today's event is so important. Mr. Chairman, distinguished ladies and gentlemen, the good news is that the board and the management of the NHIA scheme has gone one step further to make it possible for people to use the mobile application to register as new members using your Ghana card. This is just fantastic. Today, this mobile application, which is called My NHIS app, My NHIS app. Today, this mobile application will be launched to enable people to sit in the comfort of their home, or even when they are in a car, not driving of course, to sit in the comfort of their homes, wherever, or offices, and register to join the NHIS.
The Chief Executive Officer of the National Health Insurance Authority, Dr. Bernard Okuboy, has hailed the impact of the digitalization on the scheme, saying it had impacted on every aspect of its operations.
On my behalf and on that of the Governing Board, Executive Management, I'd like to thank all of you for honoring our invitation. 19 years ago, under the visionary leadership of His Excellency John Ajekun Kufuor, Ghana set out on a mission to provide financial risk protection for its citizens and to reduce the dangers of resting access to healthcare on the shoulders of the cash and carry system. This resulted in the birthing of the National Health Insurance Scheme, which has since remained a cardinal instrument in the provision of comprehensive healthcare services to all residents of our dear nation, Ghana.
The CEO, together with the District Chief Executive of Kumbungu, in the company of chiefs of the area, commissioned the NHIS District Office.
I'm very happy to be here. Very, very happy that finally we have our own NHIS office in Kumbungu. The Kufuor government created new districts so that you don't have to travel to some place before you get basic services like registering your people on the health insurance. Anytime you are separated from somebody, it comes with advantage and disadvantage. In fact, it also comes with a challenge. You have to do a lot of things to grow up to be like the person or more than the person. And after we were separated from Tolon, it became obvious that we have to work hard to get our own health insurance office. I salute you for working hard to finally get your own office.
And Dr. Okuboy, on his part, said the people can now access the full services of the NHIS without much stress.
Let me say that I have admired the energies of your MC. This DC visited me about 3 times in Accra. He said, "Doctor, you have to come to Kumbungu." I said, "Hey, from Accra to Kumbungu, it's about 8 hours." So he said, "Doctor, don't worry, you come." I just want to encourage you to support him. He's very hardworking. If you look, landlord, my own chiefs, sheikhs, In this country, if you get a leader who has a lot of energy, he can pull a lot of things from Accra to the place. So I encourage you to support him. I just learned that about 36 communities have been connected to the national grid, and he's working hard to make sure that every village in this particular district will have electricity. That is very, very powerful.
The NHI Northern Belt football team labored to a 3-3 draw against Premier League Ghana's Tamale City FC. The two teams closed up in a ceremonial match at the Aliu Mahama Sports Stadium in Tamale. Tamale City FC took a commanding lead in the first half of the game, scoring 2-1. The NHI team equalized in the second half of the game in a defensive blunder, empowered the Tamale City FC to score another goal, making it 3-2. The NHI Chief Executive Dr. Bernard Okoboy competently offset the goal and the match ended 3-3. The ceremonial match was in honor of Dr. Bernard Okoboy, who was on tour of the northern belt of the country. In the Northern Belt Tour, the National Health Insurance Authority Chief Executive Dr. Bernard Okoboy, members of the board and some management and staff of the authority paid a courtesy call on the overlord of Gonja Land at the Nderu Ajakpa Palace in Damongo.
And so today, we are here to get the blessing and support of Yagonwura so that our work to get everybody on the scheme will become easier.
I'm so we bought so from the fana. Na lakel, no question be the baton where ish. You come to na and I cover to the big God, Sakama.
And for him to know the kind of respect and value that we place on him, you can see the size of our entourage. I didn't come alone. I came with my board members, board chairman, deputy executive management staff, regional. All of us are here. All the children are here.
The Yabonwura Tutumba Borasa I conferred on Dr. Bernard Okoboy a chieftaincy title.
Your title from today is Alala Woropo. Alala Woropora. The person who does good things. Your good things will never go unnoticed. Alala Woropo. Wora. So from today onwards, Dr. Bernard Okoboy, Alala Woropo. Wora the first.
The Savannah Regional Minister, Honorable Said Muhazu Jibril, admired Dr. Okoboy's transformational leadership and encouraged him to consolidate his achievements. He said this when the board and management of the authority paid a visit to him at his office in Damongo.
One of the innovative programs that you have put in place is this my NHIS card. Yesterday I was on a app, also on a program with someone who sat down there and thought that it was just one of the gimmicks of politicians and did the card on his phone. Wow. I was there. He was shocked. He's a contributor to SNET, and he paid only 9 cedis, 50 pesos. And he uploaded his passport, everything. It was there on his phone, the soft copy. And he said, "Oh, this is just unbelievable." So it isn't something that some of us thought that once you are given that opportunity, new things will happen in that authority. And so we are very happy that you are here, at least for the first time coming to us. We go to Accra to meet them. At least come to us for us to tell us our problems.
The CEO said it was the responsibility of the authority's leadership to ensure that all residents in Ghana are beneficiaries of the scheme. He made this known when he paid a visit to the Savannah Regional Minister.
That we came here to have a feel of your challenges so that we are encouraged to work on them quicker. Sometimes when the challenges are brought to you in Accra, it's like writing a story. But when you come and walk through it, then you know that it is real. And so be assured, especially when you have my board chairman with me. If you are a CEO and you take issues to the board and they don't have a fair idea of what you are talking about, it can be in the queue for long. But when you have the board around, it's likely to get attention.
The delegation from the NHIA, making up of the CEO, the board chair, and the members, as well as management and staff of the authority, met with managers and drivers of the Savannah region. The meeting was to interact with staff and know at first hand some of the challenges facing the operations in the regions and deliberate on solutions to them. The staff were grateful for the visit, adding that it was the first time the board and management were visiting the Savannah region. Now to our final story. On Friday, December 9th, 2022, His Excellency Nana Addo Dankwa Akufo-Addo approved the NHI's free elderly care policy. This policy guarantees a waiver of the mandatory 30 days waiting period, an exemption from the premium and processing fees payment for all Ghanaians aged 70 years and above. Board Chairman Dr. NSKP Kwaku led a delegation from the authority to the Jubilee House. Chief Executive Dr. Okoboy, Deputy Chief Executive, and some directors were all present during the meeting with the President.
I'm also very happy to mention that during your time, some other benefits have been added to the scheme. End of January 2017, childhood cancers were not on the scheme. In fact, if you're a parent and your child gets a cancer, you have to pay out of your pocket. And what was sad is that, Mr. President, the fees, the charges for cancers, the drugs, they were very expensive. And so it was a very big problem. Most parents, even after starting the chemotherapy, fade out and then they lose their children. As we speak, 4 childhood cancers, which constitute 80% of all childhood cancers in Ghana, are now covered on a national health insurance scheme. The first good news is that for the past 19 years that we've had health insurance, if you want to register and come on the scheme, you have to physically be present at our office. We'll take your details, take you a picture, and give you a card. Mr. President, just this Monday at Tamale, the Vice President, with your blessing, launched the My NHIS app, which you can download on Android from Play Store. With that app, you can register and become a member on your phone without coming to us. All you need is your Ghana card. Because the National Health Insurance Scheme database is now linked to the NIA database. When you put in your details, we automatically get it. And then we generate an electronic card for you. And you have your photo that you have on your card on our electronic card. And I'm happy to say that we've received messages. People who said for years we've refused to renew, but within 3 minutes we are on. We have successfully renewed our membership. And this is great news. And Mr. President, almost all Ghanaians will now get on board without necessarily coming to ask. What is even more interesting is that it allows for third-party registration. So I can register all those in my household. All I need is their Ghana cards. And they will get messages that I have put them on the scheme. It's a very wonderful innovation. And now the challenge we are having is how to reinvent our staff, because it is possible that nobody will go to them for registration. Next year, we are going to have biometric verification. Mr. President, for these 19 years that we'll be running the insurance, all the claims we pay in the dark, in quotes, because hospitals give us documents that these people came to see us. We have no real-time evidence that they were actually there. And we've had cases that have been prosecuted in court where claims were fraudulently generated. Starting next year, we are going to, again, with the NHIS system, every Ghanaian, and we are starting with it to be phased. When you go to the hospital, you'll be biometrically verified before you are seen. So that before the month ends, I know that Konfanoche saw to 5,000 patients. They can't send me bills of 6,000 people. That alone will cut out the fraud in the system. And then the icing on the cake today has to do with the package that we have, your government has for elderly people in this country. We say that in Ghana, we have free maternal care And Your Excellency, it's because of 3 ingredients. That's why we say there's free care. If you have a scan that says that or shows that you are pregnant, and you go to health insurance, any of our office, you don't pay any processing fee. You don't pay any premium. And there is no waiting period for you to access care. All other groups have to wait for 30 days before they start to benefit from the scheme, which is a way of preventing adverse selection. But pregnant women are exempt from all these 3. Your Excellency, today, 70-year-olds and above are also going to enjoy all these 3 ingredients. We have, under your leadership, we have taken away their 30-day waiting period. Already, they don't pay premiums. And as we speak, with your inspiration, the board has set and taken away their processing fees. So once your Ghana card shows that you are 70 years, you can walk to Lekman Hospital this evening. You are brought on board on your phone, and immediately when you show it to the hospital, their system will recognize you.
I'm very happy to hear about the improvements that you have brought about, especially in your relatively brief time as Chief Executive Officer of this, the expansion in membership, the targeted expansion in membership, the management of claims. Clearly, the more claims are brought under electronic management, the greater the guarantee is to Ghanaian taxpayers that the claims are being efficiently addressed. The children and young people, both sets of people, have every reason to applaud your stewardship, because now they are being exposed and their ailments are now being part of the coverage of the authority and of the scheme. I think those are very, very important achievements that have taken place, and one to which you deserve special commendation. When we're talking about elderly plus 70, some of us have invested interest. We're invested interest in the special package for us. So we have to thank you as far as that's concerned. I think the biometric verification of patients is also another very important step in trying to give some rigor to the scheme so that as much as possible claims are verifiable in real time, not that you have to wait for hours for audits, etc. All of these are very, very important. So all I can say is to all of you, from the chairman through you, the chief executive, the members of the board, the deputies, is to congratulate you on the work that you're doing on behalf of our country. It's very, very important work. And it is important that government and the society in general mobilizes as much as possible to support the work that you're doing. And especially when it is being done with the transparency that we're seeing the development of the NHIS and the work of the authority.
Now, this is how we wrap up on this week's edition of NHIS in a Week. Thanks for watching.